What if I told you that more than 2/3 of the candidates who are shortlisted for junior doctor medical interviews actually perform below average? What if I told you that most candidates actually speak excellent English, but the problem is that they do not answer the question that is being asked during the interview? And unfortunately, for most IMGs, medical applications, CVs, and interview process is entirely a new process of learning. Hello and welcome. My name is Dr. Rizwan Qureshi, and I'm one of the consultants working in emergency medicine here in Sydney, Australia. And today I'm going to talk about medical job interviews, especially for IMGs. I have been conducting clinical orientation, face-to-face workshop, career guidance, and AMC clinical sessions in the last 2 years. I've actually had a very good opportunity of working very closely with many IMGs, and I've done interview sessions with a number of candidates, and some of them are actually quite good, but most are very average or even below average, by which I mean nearly regurgitating out your CV, which is not the way to go about it. Being an IMG myself, I have interviewed for a job as a resident, as a registrar, as a consultant, and quite honestly, I've learned from my mistakes and the feedback that I obtained from all those interviews in this regard. Now let's dissect the medical interview. Firstly, who will interview? Believe it or not, the worst fear is the fear of the unknown. So in this case, know the panel. Most interviews will have about 4 to 5 different personnel on the panel. First, there will be a director of medical services, a director of pre-vocational training. There'll also be a consultant physician or a surgeon, and there'll be someone representing nursing medical workforce, which would be a nursing director commonly. And lastly, there'll be someone from the human resources manager. They will each ask a question focusing in 4 or 5 key areas. Number 1, essential criteria and skills to match the job description. Number 2, clinical competency-based questions. These are your medical scenarios that you are solving in front of the panel. Number 3, clinical governance question like risk management, conflict resolution, complaint or open disclosure. Number 4, teamwork and clinical prioritization, by actually giving an example from your own work practice. And at the end, the interview panel will give a candidate a chance to ask a question from the panel. The whole process will take about roughly 10 to 15 minutes, and the communication skills are assessed throughout the interview. Now let's just go through some of the typical questions. First question is essential criteria and matching the job description. So the question would be on the lines of, Dr. So-and-so, please tell us what skill set and qualification do you have to match the job description. I think this question carries about 50% of the weightage. This is often the first question to be asked to give candidate a chance to speak openly about their qualification and the skills required for the job that they're interviewing for. Secondly, this question gives a very first impression about that candidate to the entire interview panel as to how the candidate is organizing their thought process, how they're responding, how are they speaking in terms of the communication and the language, the clarity. So please be very specific when answering this question. For most JMOs, the skills and the qualifications which are required are very basic. As a resident, you are meant to be doing patient assessment, which means taking the history, examining the patient, and sending the initial test and investigation. And also initiating the management, which would be providing the patient with oxygen, providing analgesia, providing antibiotic, but all in with consultation with your consultant or registrar. And then escalate about any issues that you don't know, or if the patient is deteriorating, or any other concerns that you may have. So try answer this question matching your previous experience to the expectation of the job that you're interviewing for. Do research the job well, and do research your own CV well to find a parallel example. So instead of saying that whilst working as an intern or resident in Pakistan or India, say during my clinical experience or previous clinical experience of a rotation working as an intern in gastroenterology or registrar in acute medicine or resident in surgery in a large tertiary level hospital. Name the hospital that I was working in, civil hospital, Karachi, Pakistan. I was working in so-and-so hospital in India. And you can draw a parallel that my job was there to assess the patient. I was there to initially clerk them, taking the history, conducting the examination, ordering initial tests, and then discussing the patient's management plan with my consultant and making sure those management plans are carried out by the nursing staff. And then add a personal touch that despite the fact that job was very busy, I found it challenging because the hospital was large or the hospital was rural with often very little resources, but you enjoyed that learning because it offered you a unique sense of clinical prioritization in a less resourceful environment. The skill set is another part of the question which is often asked, that what skill set do you have to match the job description? Are the skills involved like basic resuscitation skills, basic skills of, as I said, patient assessment, but more importantly, basic skills for you to effectively communicate with both your seniors and juniors and non-medical colleagues. Also the patients and their relatives, which is, mind you, 80% of your job. The second question is going to be on clinical competency, which are based on medical scenario. I think they carry about 20 to 25% of the weightage. But if you do this very bad, then obviously the interview panel will not feel very good about you being a safe doctor on the floor. Most of the medical scenarios is way of checking your clinical competence, often in managing common emergencies in a ward setting or an emergency setting. The question needs to be done very well with clear organization of your management and clinical prioritization. Most scenarios are based on clinical situations like acute shortness of breath, like acute pulmonary edema, pneumonia, reduced level of consciousness, patient who's post-ictal or having a seizure, patient experiencing some chest pain, or a critically unwell child who has got fevers and appears very flat and dehydrated. I often advise the JMOs to have a very clear BLS or ALS approach if the patient is critically unwell, or having a simple ABCD approach with the initial management of common emergencies. Remember, the scenario requires you to do the following. Number 1, calling for senior help. Number 2, stabilizing the patient's condition. Number 3, ordering tests and investigation. And number 4 is starting any initial treatment to stabilize the patient's condition. And most importantly, number 5, always remember to update the family and to check the ceiling of care or an advanced care directive, especially for elderly patients and the patients from the nursing home who may have, a ceiling of care of comfort measures or ward-based care, and not to do any CPR. So if you're doing a CPR on an elderly patient who's demented, who's got an advanced care directive, and you've not checked for it, it would not look very good during that interview. The next topic is clinical governance question. Now, these are the questions based on risk management, conflict resolution, complaint, or open disclosure. And I think they carry a weightage of about 15 to 20%. Now, these are important questions because they are based on common problems faced by JMOs. And they're also the areas where IMGs often have very little experience describing them. They have got more than enough experience experiencing them, but describing them is the main issue. So common examples are refusal to admit the patients by specialist or team or registrar, dealing with a stressful parent of a sick child, or handling a complaint or handling a rude patient. Now, what the panel is checking, they're checking your steps of dealing with a problem. Number 1, identifying the issue, troubleshooting those issues within your capacity, and if it's beyond your capacity, escalating those issues and giving a resolution. Open disclosure might be based on your personal example. So they may ask you a question, doctor, can you tell us about a mistake or a complaint that has been put against you, and where did you learn from it? One thing I always advise that please do not mention the details of the complaint, but highlight the learning points. They might be points about your education, they might be points about your training, they might be points that you learned about a new way of communication, having a cultural competence which was not there, but you had an opportunity to improve that area of your communication or your skills. Something to improve your professionalism. And as always, give a personal example, because anybody could give a very generic, response, but the panel are able to judge who's right and who's just fabricating a response. Teamwork and clinical prioritizations are another major topic which are coming a lot during the interview. And they want you to, demonstrate by giving a real example from your work practice that you are able to, work in a very busy clinical environment, and how would you prioritize your workflow. Now, these questions are popular. Why are they popular? Because the hospitals are getting very, very busy. and the patient workload is such that you may have to delegate some of the task and prioritize the other task. One of the questions that recently get asked is you're doing a board round with your consultants, and your consultant has asked you to discharge 2 patients immediately, because this would help create more room for the new patients to come from emergency. At the same time, the nurse in charge wants you to complete 2 medication charts to be reviewed and redone, because the patients are overdue their morning medications. Now, obviously, both these jobs are equally important, and what helps is to justify a prioritization and delegation approach. You will delegate one task to your colleague in a team, and that might be your colleague resident, there might be a colleague intern, or even a registrar, that look, this is a problem. How about we split the task? Also, some of the other options could be that you can say to the panel that I can put the patient into a discharge lounge where he can wait, so the beds would be empty. At the same time, I'll do the discharge paperwork whilst they were actually waiting to get picked up to the nursing home or to their home. The other option would be to send the paperwork in the post, but giving patient enough information about their immediate management and what has happened during their stay in the hospital. At the end of the interview, the panel is going to give you a chance to ask a question from themselves, which I think is your chance to show your interest without sounding too desperate. Always thank for an opportunity for the interview. Show your willingness to join the hospital, the team, but also ask questions that how's the roster like? What's the on-call commitments like? You can also ask if you've got an aptitude for audit and research, that is there an opportunity to do some research and audit? If you've done that, if you've not done that, then probably it's not worth mentioning that, because that would just sound too desperate. And lastly, ask them to give you a feedback. Even if you're not successful in the interview, if you want to make that interview count for the next one, is to always ask for a feedback. I hope you found some of those points really useful. If you want to join me for my next medical career guidance workshop, please do visit emergencyfocus.net and register for that workshop. It's an initial workshop which is in the form of the video lectures, and then we'll do a live sessions. I wish you all the best. Thank you very much. Goodbye.